welcome back to part 2 of our pregnancy and oral health series. Today we're going to be talking more about how to take care of your teeth, since what you do with your teeth affects your baby. We're going to focus on yours, and if you remember, last time we focused on you, mostly your baby's health with the teeth. Before we begin, we're going to review just a little bit of what we talked about from the last video.
What kinds of food help build up good teeth structure?
Foods such as, with arginine, such as legumes, nuts, seeds, and cheese and turkey.
My oral hygiene is not contagious and will not affect my baby.
False. Your teeth and oral hygiene can affect your baby even while you're pregnant.
What is a better alternative to put in your baby's bottle if they are going to sleep?
If you're going to have your baby go to sleep with a bottle, make sure that it's filled with just water. Remember that your oral health can affect your baby's oral health drastically, even while you're pregnant with them.
Did you know that your mouth has an oral pH number? What's normal is usually 6.8 to 7. And what happens when we eat is that the pH levels in our mouths start to go down, meaning they become more acidic. And when your teeth and oral environment start to become more acidic, then the bacteria thrive even more and start eating around your teeth, and that's how decay slowly but surely can start. So let me tell you a few examples looking at this pH scale. In the middle, where the 7 is, where it's green, that's the neutral pH. That's where you want to be. It's a good, healthy pH for your teeth and your mouth. When we go to the left more, towards 3, that's acidic, which we just talked about. You want to try to stay away from that area. And then alkaline is higher, which is the more basic side. So for example, we're going to focus more on the acidic. You've got the soda. You've got beer and sugar, caffeine, cocoa, fruit juice. And if you eat a lot of this, especially like snacking on them at a really close interval within each other, your teeth and mouth is not able to go back to neutral. So you want to try, if you do have these acidic foods, put some time and space between them before you eat some more acidic foods. But the better option is staying away from them and keeping your mouth at a more neutral pH.
So when we eat food, our oral health becomes very acidic, and acidic environments lead to demineralization of teeth. So what happens is bacteria, they feast on the sugar that's inside our mouths, which create a more acidic environment. Between meals, our pH levels go up, which is more towards the basic side, and it happens because we have saliva in our mouths. Saliva can change these acidic environments into more basic with the help of calcium and phosphorus.
So when you're eating, your pH level will drop down to the acidic level and then stay there for about 40 minutes before rising back up. And so it's really good to refrain from eating and snacking throughout the entire day, so that your teeth have a chance to go back, your mouth oral pH has a chance to go back to the neutral level, and so your teeth won't continually be in the acidic environment and continually be deteriorated by the acid levels and the bacteria. So another good way to help your oral pH go back to neutral is to drink water throughout the day. Water is a pH of 7 typically, and so that actually rinsing out your mouth and drinking water can actually help it go back to neutral.
Going off of what Katie just said, when your teeth start to break down, that's usually at the pH of 5.5. And it usually takes about 19 to 22 months before cavities start to form. So you may think you're doing great, but then later on when you go to the dentist, they say, oh, you've got a cavity forming. Well, that might be because your pH was just so low over that time that your enamel had been actually breaking down. So if you look in this diagram, you can see that when you're not eating, your pH, like what Katie said, goes right back up, and then when it was lunchtime, it went down to 4. So you can see why it's really important not to snack in between, because you want enough time for your pH to go back up to neutral and stay at neutral. So between lunch and dinner, this person had soda, so that didn't give him enough time to stay at a neutral long enough throughout the day. So, I mean, teeth-wise, that's really detrimental to the enamel, and he had a lot of time during the day for his enamel to start, getting broken down because of the acidic environment.
Okay, so now we're going to talk about caries. Caries is basically bacteria eating away your teeth and your teeth demineralizing. With a combination of bad oral hygiene and poor diet, you're very susceptible to getting a caries, or a cavity, as we commonly say. It could result in sensitivity, pain. You can have multiple restorations, which would affect you financially. It may spread to the rest of your mouth and your child's health. It can affect everything, you and your baby's life.
Remember, cavities are contagious, even to your unborn child.
So there's 3 stages to periodontitis, which periodontitis is when the bone around your teeth starts to deteriorate. So the first stage is called gingivitis, where your gums, it's just your gums starting to inflame from the plaque or the tartar buildup around your teeth. The next stage is when the infection keeps on spreading and it starts to destroy the supporting bone around your teeth. The next stage is that the infection keeps to progress and eventually turns into a disease with further bone loss. And remember that you can spread this infectious bacteria through your saliva to your loved ones and your baby.
So about 80% of the women, they get morning sickness during pregnancy. Morning sickness is basically when you wake up in the morning and you feel nauseated and you vomit. So what happens is your vomit is very acidic, and whenever it touches your teeth erode and demineralize. Morning sickness usually starts around 6 weeks, and it usually ends around 16 weeks. So some quick tips for what to do when you do have morning sickness and what not to do. Make sure you don't brush right away, because your teeth are still in an acidic environment. There's vomit up there, and if you brush it too hard, you can damage your teeth. And what to do is rinse it with water and just leave it at that. So it would help your teeth to go back to neutral, and it would help your teeth from getting demineralized. Another to-do tip is that you can brush 30 minutes after you vomit. So just rinse it with water, leave it for 30 minutes, and then you can brush.
Remember that thing called gingivitis that Katie talked about earlier? Well, that's another way of saying gum disease. And when you're pregnant, usually for a lot of women, your gums tend to become more inflamed and sensitive. So if you can see here, that's healthy gums to the right and gum disease to the left. And this usually happens from the buildup of plaque and tartar. So this means that it's even more important for you to keep your gums clean while you're pregnant, so that your teeth stay healthy around, because a lot of people tend to develop cavities while they're pregnant because they just don't take good enough care of their buildup. Go.
You can expect to see many other different oral manifestations of your hormone changes during pregnancy, such as the image to the right here. It's called a pyogenic granuloma, but don't worry. These will go away after you give birth. Or you can, if they are really bothering you, talk to your dentist and they can have it removed, but the chances are it might come back during your pregnancy. And like I stated earlier, these are because of the different hormone changes that you're going through during your pregnancy. So now we're going to talk about brushing your teeth properly. First, you get a soft bristled toothbrush. This doesn't do any damage compared to the hard bristled toothbrush or medium, because when you brush your teeth with a hard or medium toothbrush, it can actually wear away the surface of your tooth. So when we go into your mouth, you're going to tip your toothbrush bristles at about a 45-degree angle towards your gums. So if you're on the bottom like this, you're going to tip it down towards your gums. If you're on the top, you tip it up. And then you kind of just do kind of a wiggle. So you're going to brush kind of like that at each section of your toothbrush length. And what I like to do is I like to count to maybe 10. So I go 1, 2, 3, 4, 5, and count to 10 in each toothbrush length, all the way around your mouth, with it tipping towards your gums. And then how to get inside towards your tongue and your palate is you do the same thing, you just tip it towards your gums and here. But then right in the front, you can't really have it this way. It doesn't fit your toothbrush, so you go up and down. Or like this.
So flossing is a very important part of our oral health. The first thing that you need to know about flossing is how to hold the floss so you don't jam it up your gum and it doesn't start bleeding, it doesn't hurt you. So what you do is you wrap it around your middle finger to your desired length, and then you basically control with your index and your thumb. And how you want to go in between the teeth is you do a little seesaw motion basically. You just go in and then you wrap it around the tooth. We call this method a C-shaped flossing method. What you're doing is you're creating a C around the tooth and you're just going up and down. What I like to do is count to like 3 maybe. So you wrap it around, go up and down 3 times, and you wrap it around the other surface of your other tooth and you go up and down 3 times, and then you pull it out.
Now we're going to go over some common myths that some pregnant women find true or false about their pregnancy. First one is, my baby is pulling out all the minerals that my body has and will cause my teeth to be brittle and will fall out. False. This is not true. Your teeth will stay put wherever they are. Your baby does not suck minerals out of your teeth. But if your teeth do fall out for no apparent reason, you should definitely seek medical help.
So another one of the myths is that it is not safe for me to get a dental checkup while I'm pregnant. In reality, it is fine for you to go visit your dentist, especially during your second trimester.
Go.
The next myth is that fluoride is not safe for me or my baby. In reality, fluoride is perfectly safe for your baby as long as you do not take too much and you use it properly. It is possible to overdose on fluoride, and that could be really bad. But if you're just brushing your teeth or rinsing your mouth with mouthwash or both even, it's perfectly safe. Another thing with fluoride is that if you do take too much during pregnancy and while your baby's teeth are developing, they can develop a thing called fluorosis, which is kind of the too much fluoride is being deposited in your baby's teeth. And while it can look really bad, as you can see in these pictures, it is actually not harmful for your baby. It actually helps them to prevent cavities in the future as well. But it still is not too great to have it because it does look bad. And it can cause discoloration and brown spots.
Another question is it fine to visit your dentist while you're pregnant? Yes! It's true, but just make sure you let your dentist know that you're in your first trimester when you go. If you need anesthesia, you can get small doses, but avoid any big major surgeries. With the anesthesia, it's safest to have it during your second or third trimester, so try to avoid it during your first, because as you may already know, first is when your baby's really developing the crucial organs. And if you need nitrous oxide, you want to avoid using that as well. But if you need it, 50% oxygen should be used for short-term use.
But during your pregnancy, are radiographs okay?
Yes.
According to ADA, radiographs are considered safe for the pregnant patient at any stage during pregnancy. What you need to take care of is make sure you're properly shielded against the x-rays, which is basically proper lead and thyroid shielding. It would keep you and your baby safe from the harmful x-rays. Even though radiographs are safe, when done properly, make sure you, if possible, postpone it and have them done after you're done with your pregnancy.
Hope you learned a lot. We're going to do a quick quiz review now to see how much you've learned. The first question I have for you is, does bacteria in our mouths thrive best in a basic or acidic environment?
Acidic. Remember that when bacteria is around acidic environments, they tend to demineralize the teeth a lot faster, so you want to keep your mouth as close to neutral pH as much as possible.
True or false? It is better to snack throughout the day because this will encourage resorption in your teeth.
False! No, you don't want to snack throughout the day because then your pH levels aren't able to go back up to neutral, and if you snack throughout the day, it will encourage resorption, which you don't want to happen.
As you experience morning sickness, you should brush your teeth right away to get all of the vomit off of your teeth.
No, please no. Make sure you wait at least 30 minutes before brushing again, so just rinse with water, wait a sec, and if you really want to brush your teeth, you can brush in about 30 minutes later.
A pyogenic granuloma is cancerous and should be removed immediately.
No, pyogenic granuloma is not cancerous. It may just come and go, but if it bothers you enough, you can get it removed.
True or false? You can expect your gums to be inflamed and slightly bulbous during your pregnancy.
This is true. Remember, you've got a lot of hormones going on in your body, and that tends to affect your gums. So if you see that they're slightly more red, a little more puffy, then that's normal. Just make sure you keep up with your oral health and clean them regularly.
When is it the best time to see your dentist during your pregnancy?
Try to see your dentist during your second trimester.
Radiographs are never safe during pregnancy.
False. Radiographs are okay for pregnancy. Just make sure you have the really nice lead apron put on well on you. But if you'd like to wait till after pregnancy, that's great too.
Thank you.
That's all for today.
Hope you learned a lot.
Good
See
luck.
you next time.
Congrats on your baby.